Hypertonic therapies for increased ICP and brain herniation. Let's talk about it. Remember that the brain lives within a fixed compartment. The skull is not stretchy, which leaves very little room for activities. So if a patient has an increase in cerebral edema, fluid, hemorrhage, something that's taking up more space, we can very quickly see an increase in intracranial pressure and a decrease in cerebral perfusion. So how does hypertonic saline help? This is very salty saline. And so when we put it into the bloodstream, we know that water follows salt. And so our body is going to naturally try and dilute this. So when it makes it to the brain, it will draw fluid out of the cells and decrease cerebral edema, leaving more room for activities, decreasing ICP and improving cerebral perfusion. This is absolutely not a fix for brain herniation, but it can be a transient band-aid while we're getting them where they need to go. For agencies that don't have hypertonic saline, sometimes they will use poor man's hypertonic or sodium bicarb. Sodium bicarb is also very salty and can be equated to like 6% saline. However, remember that when you give bicarb, this breaks down into CO2. That's why you'll often see a spike in your end tidal after giving sodium bicarb. One of the things we want to avoid in our increased ICP and herniation patients is hypercapnia because it causes cerebral vasodilation, okay? So if you are using sodium bicarb as a hypertonic solution, make sure that the patient is ventilating adequately or you are ventilating them adequately to compensate for that increase in CO2 and keep their end tidal within those normal limits. As always, avoid hypoxia, avoid hypotension, keep their end tidal within normal limits, and get them to a definitive trauma center.